What are common retinal issues?
Some of the more common diseases that we take care of in clinic are retinal detachment, retinal tears, and vitreous detachment, and as well as some medical retina conditions like macular degeneration, diabetic retinopathy, retinal vein occlusion, and some inherited retinal diseases.
What are the early signs that there is an issue with my retina?
Well, it depends on the issue. So some of the early signs that you'll have a problem with a retinal detachment or a retinal tear, the most common first symptoms would be some new floaters in your vision, some new flashing lights on the side, and then later on you might notice loss of vision from these things.
What can I expect after retina surgery?
There are several different ways that we fix retinal tears and retinal detachments. Some of the therapies include clinic-based procedures like laser retinopexy or cryotherapy, where we basically spot weld the retina in place when there's just a tear. If the retina is detached, that's not effective, and so we need to use a gas bubble or a larger barrier laser to fix the retinal detachment. And those typically are very fast in recovery. So if you have a laser procedure to your retina, often you won't see well for about 20 minutes. And generally there's no pain afterwards, and there's no drops or aftercare. We just take a look at you again a few weeks. If you have a bigger procedure where we have to go to the operating room, there's a lot more involved. Those patients may have some bruising around the side of their eye. Their eye might be filled with a gas bubble that lasts anywhere from 2 to 8 weeks. And so when you have a gas bubble in your eye, it impairs your vision, and you can't fly in an airplane while you have that gas bubble in because it can cause the pressure to go up inside your eye. We usually have people wear a patch just for the first night after they have their surgery, and sometimes they may have some swelling or bruising around the side of the eye for the next few weeks.
How has technology changed retinal surgery?
Historically, retinal detachments and diabetic retinopathy with vitreous hemorrhage was repaired using vitrectomy surgery that used large gauge incisions. These required sutures and a lot longer for the recovery. More recently, we've developed small gauge, minimally invasive surgery where we don't even use sutures to close the wounds because they're so small. And these people have less surface discomfort after the surgery and typically have a relatively painless journey through their post-operative care.